Hi, welcome to Brain Powerz channel. Today we are going to discuss about anatomical planes and cavities. Planes are imaginary lines to locate the specific organ or tissues in anatomy. There are 4 major types of planes, of which 3 planes are important. Mnemonic to remember them is SCTO. 1. Sagittal plane, also called as median plane. 2. Coronal plane, also called as frontal plane. 3. Transverse plane, also called as axial plane. 4. Oblique plane. In Latin, sagittal means an arrow. When vertical line cut the body into 2 equal left and right, it is called as mid-sagittal plane. Other plane, parallel to this mid-plane is called parasagittal plane. It divides the body into medial and lateral position. Medial means towards the body. Lateral means away from the body. Ipsilateral means found in same side. Contralateral means found in opposite side. Movements that occur in the sagittal, longitudinal, plane involve forward and backward movements. The movements of the sagittal, longitudinal, plane include flexion, bending a limb to decrease the angle at a joint. Extension, movement that increases the angle at a joint. Dorsiflexion, bending the ankle so the top of the foot and your toes move toward your shin. Plantar flexion, bending the ankle so the foot pushes down and your toes point away. 2. Coronal or frontal plane. The vertical line passes through the body along the side, dividing the body to anterior and posterior position. Anterior, otherwise called as ventral, in simple words as front. Posterior, otherwise called as dorsal, in simple words as back. Movements that occur in the coronal, frontal, plane are lateral or side to side. These include abduction, moving your limbs laterally, away from the midline of the body. Adduction, moving your limbs medially, toward the midline of the body. Elevation, moving towards the superior position. Depression, moving towards the inferior position. Inversion of the ankle, sole of your foot turns inward toward the midline of the body, a component of supination. Eversion of the ankle, sole of your foot turns outward away from the body's midline, a component of pronation. Transverse plane, horizontal line passing through the body, dividing it into superior and inferior position. Superior is also called as cranial position. Inferior is also called as caudal. Proximal means towards the point of attachment. Distal, away from point of attachment. Movements that occur in this plane involve rotation or horizontal movement, which include rotation, rotating the torso or a limb around its vertical axis, e.g., turning your head to the left or right. Horizontal abduction, moving the arm away from the midline of the body when it's at a 90-degree angle in front of you. Horizontal adduction, moving the arm toward the midline of the body when it's at a 90-degree angle to the side. 4. Oblique plane, plane that is not horizontal or vertical. Body cavity is any space or compartment which contains organ. It is divided into dorsal and ventral cavity. Dorsal includes cranial and spinal cavities. Ventral body cavity includes the thoracic cavity, enclosed by the rib cage and contains the lungs and heart, and the abdominopelvic cavity. Other hand divided into open and closed body cavities. Closed includes cranial, vertebral, thoracic and abdominopelvic cavity. Closed cavities are lined with membrane. Open cavity include respiratory tract, digestive tract, urinary tract. Open cavities are lined with mucosa. Thank you for watching Brain Powerz channel. Share the knowledge with your friends. Subscribe Brain Powerz for more updates.